Welcome to Des Moines, Iowa, where politicians come to pump up their presidential prospects, and where physicians at the Iowa Clinic pump up their leadership and collaboration skills, thanks to the Physician Leadership Institute.
When people ask us whether our physician leadership program had a bearing on our ability to make bold moves, there's really no doubt in our mind that it served a very key purpose.
I was ecstatic to be part of the Leadership Institute.
When the Iowa Clinic's analytics director, Austin Lepper, and his dyad partner were picked to take part in the Physician Leadership Institute, or PLI, they were thrilled. They and about a dozen other clinic physicians, clinicians, and administrators were going to take part in a year-long development program.
I didn't know much at all about what Austin did. The Leadership Institute for me was a great way to grow and develop professionally beyond just what you need to know as a doctor to treat people and disease, but then to learn about how to actually be a functioning member of an organization.
We're trying to change the DNA in the way we look at things, and so that you not only see yourself as a clinician, you see yourself as a clinician leader or a physician leader.
PLI is dedicated to creating high-performing healthcare systems where administrators, physicians, and healthcare team members collaborate to provide coordinated quality care for their patients and aligned and engaged leadership for their organizations.
If you want to have a good working relationship, you have to understand that not everybody does things the same way you do, and if they understand you and you understand them, you're going to have better outcomes.
High-performing teams require trust, engagement, and alignment. To achieve that, PLI focuses on 5 main goals. First, leading with purpose. Why do doctors and administrators get up in the morning? What's their mission, their purpose? Second, leading with strategy. When they figure out a purpose, how do they translate that into strategic action? Third, leading self, realizing the authenticity of who they are and what they do. Fourth, leading others. How do they engage the hearts and minds of everyone on a team? Fifth, leading for result. Taking those transformative steps from point A to point B and feeling the sense of accomplishment towards the ultimate mission.
Everybody learns differently, but this is a really neat way to learn, if you will, and I think that you can retain it better than maybe seeing something online, a webinar, something that you read in a book.
How does PLI do all that? Through hands-on coaching, collaborative team projects, and a series of customized, out-of-the-box development exercises to create powerful lessons and lasting impact.
Horses are a great, authentic being, and they will sense beyond the way you show up. Even if you're nervous and you're trying to pretend not to be nervous, they will sense that.
Yes, horses. The healthcare trainees have to literally lead a horse to water and make him drink, but they can't even touch the horse.
Eventually, we learned how to control our nonverbal cues and got it done, and it was amazing.
And then there are physicians like Dr. Dan Colmorgan, an Iowa Clinic surgical oncologist.
My initial response was, no, I don't have time for this.
The way he saw it, he was already a leader, already a collaborator. But he graduated from the leadership program a changed man.
It made me have different view on my response to things and being a better listener, other ways to get things done rather than just by force or power.
But when participants graduate from the program, do patients get a better experience?
I think it's made my clinic much more efficient. Hopefully I'm more efficient. I really value my patients' time, and I tell them that.
We hear about later on from patients and describe, it was how they sat down and talked to me and how they explained their circumstance. Those are the intangible things that continue to mount up day after day that we want to represent who we are, and we believe the Physician Leadership Program has helped do that for us.